My name is Jennifer Brown, and I'm one of the Child Life Activity Assistants here at St. Luke's Children's Hospital. For me, mostly, my main job is to make sure that the kids are having a good time while they're here receiving treatment. We do activities with all of the patients as well as their siblings, so that's the main part of my job. So here we treat children with cancer as well as bleeding disorders, so oncology and hematology. I think it makes it easier for them to get through the day here because sometimes they're stuck for several hours, sometimes all day, and they get bored, or they're sometimes we are doing things that aren't always fun, like poking them or blood draws and giving them medicine and stuff that makes them sick. And so I try really hard to make sure that they are to help them cope with that a little bit better. And we do medical play here. We do all kinds of things to make it easier on them, and basically just make it as fun of a place as we possibly can. But it probably affects how, I would say, maybe how they handle their treatment, because anytime that you're having fun, right, it makes things a little less scary. It makes the environment a little less scary if we can do things to make the kids want to come here. Sometimes we have a harder time getting the kids to leave than we do getting them to come, because we've tried to create an environment where they feel safe and where they feel like they're going to have a good time. And so I think it helps them get through their treatment a little bit easier. So in Child Life, we do what's called medical play, where we help the kids learn a little bit about what the different things that they're going to be going through as their treatment goes on. So basically, we have a medical play room in the back where the kids can go and play with dolls, and they actually get to practice things on the dolls. Like they'll practice blood draw, what it's like to get your port accessed. They'll get to talk about what it's like to go into for a scan, like an MRI or a CT scan. And so we have medical play things that are made for dolls that are in that room that the kids can go in and learn about, so that they know what they're going to go through. So if they kind of play first, then it helps them be a little less scared when they actually have to go through it. So the kids absolutely loved them. They were wonderful. They were a huge hit. We're not quite done yet, but we still have a few left to do. But everybody loved them. The kids, we even had a couple kids work on their sock puppets together, and then when they were done, they played together. And so that was really cute. 2 different families, so they got to build relationships with each other, with other kids in the clinic, which was great. And so it was really fun, and they turned out really cute, and they were all different, which I absolutely loved, because one of the best things that I like to do for the kids is I've never been a big fan of all kids' artwork being the same, so I'm really big into the process instead of the product, which basically means letting kids explore and create things on their own, and so that they're not all the same. And so I really liked that they all came out differently, and the kids really enjoyed the dream catchers as well. Those were a big hit too.